I recently made an episode about something that happened in my family. I introduced the fact that pharmaceutical companies were paying out billions of dollars to doctors and hospitals. I raised the question, why? Why would they do this if the system were as simple as you go to the doctor when you're sick, they diagnose your illness, and prescribe you the appropriate medicine? Why would there be any need for pharmaceutical companies to be paying anything to doctors and hospitals, let alone billions? It doesn't seem at all logical or practical. We also looked at how many lawsuits there have been for unapproved use of approved medicine. Another main reason for the lawsuits was kickbacks. What's a kickback? In business and commerce, a kickback refers to a form of bribery or unethical practice where someone, typically an employee or a contractor, receives money, goods, or services in exchange for providing favorable treatment or business opportunities to another person or entity. The suits we're about to consider include both unapproved use of approved medicine and kickbacks. From the title of this episode, I'm sure you can see what some of those kickbacks were. We're going to dive into how it works with a case that made headlines a few years ago when multiple states filed suit against a company named Insys Therapeutics Incorporated, its high-level executives, and several doctors for a drug called Subsys. Let's get started. This is a special report by Cassidy O'Connell. Sex, drugs, strip clubs, and death. How Insys sold millions of dollars in addictive prescriptions. Part 1. Welcome.
Insys has reportedly disclosed more than 900 substance-related deaths to the FDA.
Former executives and managers for Insys Therapeutics are accused of bribing doctors to prescribe a highly addictive fentanyl spray.
Profits are too big, way too big.
Good morning. Those former Insys executives and managers are charged with conspiring with one another to use bribes and kickbacks for doctors who wrote large numbers of prescriptions. The video showing...
If you're going to intentionally, knowingly break the law, your profits have to be so significant that when the FDA comes knocking and they hit you with a $425 million penalty, you're still smiling. You're sad in front of them, but when you walk out the door, you're smiling. You're smiling because you just made $1 billion worth of profit.
Prosecutors say the person wearing the Subsys costume, labeled with the medication's highest dosage, is Insys' former vice president of sales, Alec Burlikoff.
I love titration, yeah, that's not a problem.
As mentioned, Insys Therapeutics was sued by multiple states, and the federal government stepped in to assist in those suits. In the end, the co-founder, doctors, and members of the sales team were found guilty. Huge fines were paid, and some even went to prison. What were they doing to bring these charges about? And how did it come to light? It started with Maria Guzman, a former sales rep who was hired in January 2012, which coincided with the time period that Subsys was first approved by the FDA. After spending a year and a half in the company, she complained about some of the things she was witnessing taking place and the sexualized, aggressive atmosphere in the company. She was fired in July 2013, shortly after her complaints. Sometime after being fired, Maria Guzman filed a qui tam lawsuit against Insys and its executives. A qui tam lawsuit is a type of whistleblower lawsuit based on an ancient writ in England where a private person may prosecute for the government and receive a reward. There are several different ways to pronounce it, but my personal preference is qui tam. It's short for a Latin term meaning in the name of the king, and it can help governments recover money for their treasury and for taxpayers. Though there were others who also joined in this whistleblowing, Miss Guzman's is the most thorough suit, so I'll be using hers as a reference. Also, many states filed suits, but I'm focusing today on the suit by Mark Mrnovich, Attorney General in Arizona at the time of this suit, because this was their home state. I will be tying in info from other state suits as well, specifically New Jersey. This particular suit is against Insys executives, salespeople, and the main doctors writing the prescriptions. It represents 24 states and Washington, D.C., as we see in the first few pages of the complaint. California, Delaware, D.C., Florida, Georgia, Hawaii, Illinois, Indiana, Louisiana, Massachusetts, Michigan, Minnesota, Montana, Nevada, New Hampshire, New Jersey, New Mexico, New York, North Carolina, Oklahoma, Rhode Island, Tennessee, Texas, Virginia, and Washington State. That shows how very broad this problem was. It contains 35 counts ranging from false claims in each state, Medicaid fraud, and illegal retaliation. The listed defendants are Insys as a whole corporation, Michael Babich, who will ultimately be sentenced to 30 months in prison, which interestingly is 6 months more than the government suggested. He was the former CEO and pleaded guilty while also claiming to be the scapegoat. He testified against former colleagues, including the founder of Insys. Alec Burlikoff, whom you saw in the intro dressed as the medicine, was formerly a guidance counselor and basketball coach at Pinecrest School in Boca Raton. He went on to become the vice president of sales and national sales chief for Insys. We'll dive into his past with Cephalon Pharmaceutical Company that was also criminally charged and paid $425 million to the federal government to settle 4 whistleblower lawsuits and a criminal charge alleging Cephalon had marketed 3 different drugs for off-label, unapproved uses. This is called off-label promotion. A doctor choosing to prescribe a med that they think will help an individual patient is different from a pharmaceutical company making claims and promoting a drug for off-label use. Off-label promotion is the unlawful practice of a company marketing its pharmaceuticals or medical devices for uses that the Federal Drug Administration has not approved. Burlikoff was recruited by the founder of Insys early on, and he brought the methods that he had learned at Cephalon in a gruesome repeat that went even beyond what happened at Cephalon. His tactics include the sham speaker events and hiring a slew of beautiful dancers, strippers, cheerleaders, and even a Playboy bunny to seduce doctors into writing more prescriptions for Subsys. They provided lap dances to the doctors and even sexual relationships in return for said prescriptions. Burlikoff also threatened to fire and in some cases actually fired sales reps who were not bringing in enough prescriptions from their doctors. He referred to the doctors who wrote a lot of prescriptions as whales. While active in Insys, he described his tactics as based on the Wolf of Wall Street. Yet when called to trial, he became a doe-eyed patsy who didn't fully understand what was happening. We'll delve a lot more into him in episode 2. Finally, the suit is also against former Dr. John Kapoor, who is the founder and chairman of Insys. He ranked 577th on the 2015 Forbes list of the world's wealthiest people. He grew up poor in India, became a doctor in the United States, but greed led him to sell his product at all cost. As a medical doctor who fully understood the risks, he was found the most culpable and sentenced to 5 years in prison for illegal promotion of his drug, Subsys. What is Subsys? Subsys is fentanyl, but not just a fentanyl pill. It's a transmucal, immediate-release spray that's applied directly under the tongue where it can rapidly reach the bloodstream. Subsys is 50 times stronger than heroin and 100 times more potent than morphine. It's part of a special class of drugs known as TIRF, or transmucal, immediate-release fentanyl. There are going to be a lot of abbreviations throughout, so you might want to take note of them. But TIRFs are subject to a risk evaluation and mitigation strategy, or REMS, that is federally mandated by the FDA. This means that both patients and physicians must enroll in an education program to minimize the risk of misuse, abuse, addiction, overdose, and serious complications associated with TIRFs. The FDA highlights 2 dangers in their labeling for Subsys, and they are fatal respiratory depression and the potential for abuse. A very important and repeating theme throughout this is that the FDA had approved this drug for a limited indication, the breakthrough cancer pain we spoke about, and also limited it to patients over the age of 18 who were already receiving and tolerating round-the-clock pain meds. What is breakthrough pain? As we know, cancer is very painful. In certain cancers, there tends to be a constant pain that meds can keep to a tolerable level. We see it illustrated here. But even on these round-the-clock meds, there are sometimes points where sudden, intense pain rises beyond what regular pain pills can cover. These are usually episodes of limited duration, but very intense, and this is breakthrough pain. Subsys wasn't approved for just any breakthrough pain, but specifically for breakthrough cancer pain. Because of the risk of fatal respiratory depression, there are contraindications, meaning circumstances where the drug should never be used. They are an intolerance to opioids, postoperative pain, headaches or migraines, dental pain, or in the emergency department. If you have severe bronchial asthma, it cannot be given in an unmonitored setting without resuscitative equipment. Known or suspected gastrointestinal obstruction, or known hypersensitivity to fentanyl or other components of Subsys. There are multiple warnings on the label about the potential to cause death, especially in non-tolerant patients, which is why it's indicated only for patients who are already tolerating round-the-clock opioids. Bear this in mind throughout this podcast. These people knew all along that this carried the possibility of death. In addition, there are certain patient types who should not be given these medications without intensive counseling and monitoring for signs of addiction, as well as stressing to prescribers that these are sought-after drugs and strategies to reduce the risk of addiction must be put in place. Some of these patient types are patients with a personal or even a family history of substance abuse, drugs, or alcohol. Patients with mental illness, including major depression. Any patients in this category would require intensive counseling and intensive monitoring. Bear that in mind as we tell this story. Now, because of all of these warnings and contraindications and the small scope of patients approved to use this, it would have left the potential sales in a very low earnings spot. So Insys devised a subversive and illegal scheme so evil and depraved, I can't believe they were able to find so many people to carry it out. Insys directed its sales force to push healthcare providers to write prescriptions for more patients and at higher doses to treat chronic pain of any type, despite the known dangers. Subsys sales accounted for 98% of Insys' net revenues, so they were willing to do whatever was necessary to drive these sales, even as the number of deaths from it racked up. There were three main aspects to this scheme. One, they set up their own company within the company called IRC, or Insys Reimbursement Center. This was a call center that was designed to obtain prior authorization for Subsys from insurers and PBMs or pharmacy benefit managers, which are companies that manage prescription drug benefits on behalf of health insurers. We'll detail that in a minute. 2. Misleading information. This went from carefully wording what they said to outright lies. This mainly involved lying to healthcare professionals that they wanted to write the scripts about the conditions in which the FDA approved Subsys. It goes on to include lying to insurance companies to get the approval we spoke about in point 1. Basically, everything about this company and this scheme was a lie. Using what's been called an effective dose campaign and a slogan, "Pain is pain," we'll go into detail in this series about how they managed this. The third point was they paid sham speaker fees to doctors to run supposed educational events, but in many cases, there were no speeches. They may be trips to a strip club, even including special champagne sessions in private rooms, after which doctors sent thank you emails for their so-called best night in years. There were events at shooting ranges, in offices including a staff party, or expensive, extravagant dinner reservations for doctors and their wives. Now, in the real medical world, doctors have to complete continuing education on an annual basis. Doctors who give real speeches at real events do receive legitimate pay, but in this case, kickback pay for writing prescriptions was transferred to payouts for these imaginary speeches that they claim to be given in order to incentivize them to prescribe more Subsys to their patients. And we'll get into the details of all of this as we go through this series. Let's talk about number 1, the IRC, or Insys Reimbursement Center. Subsys was very expensive and had all these limits. That meant it was going to be nearly impossible to get insurance approval, and very few people could or would pay for it out of pocket. Add in the fact that its approval is very limited both in dose and indication for cancer, and it would have made this drug very limited in money-making abilities. So what did they do? In November 2012, they set up this company IRC as mentioned. At its onset, only 12 prescribers used IRC, but by December 2013, more than 950 prescribers nationwide were using it. This team was headed by Liz Jurieri, and we'll be looking at her communication throughout this part. So what they would do is direct the healthcare professionals that were writing the prescriptions to let IRC handle these prior authorizations rather than doing it in their own offices. Instructed by Jurieri to do whatever it takes, they knew that insurers were less likely to approve if the call came from the pharmaceutical company, so they would pose as the healthcare professional's office when they called insurance companies, and they were specifically told by Jurieri never to mention the Insys name in any written materials submitted to a third party. Now, this drug is being sold throughout the U.S., so there was a difference in area codes between the IRC and the HCPs. The different area codes would be a dead giveaway that these calls weren't coming from the healthcare professional's office. Also, the emails were affiliated with Insys, as we can see, for example, in this email. To get around that, callers from IRC were actively concealing the phone number by blocking it. They knew that if insurance companies saw that these calls were coming from Insys, it was almost a sure denial. But this presented a problem. As we see in this email, it's asking for a better way to conceal their identities to help them get approvals and win appeals. And speaking of appeals, it says that they're required to file them online, which prompts them to input an email address. Sometimes there's a fax transmittal error, which would require inputting their email, or sometimes they were just asked for an email. So here they're asking, can there be a generic email that doesn't link us to Insys? They also note that some insurance companies will not accept calls from blocked numbers. So what had they been doing? Calling from their personal cell phones. So they wanted an option of a generic phone number to get around this. But that's not all. This kind of off-label use needs to be justified by the doctor for the patient. He would have intimate knowledge of their medical condition, their history, plus his or her own medical expertise. This drug company doesn't have any of that. They have one thing: their desire to sell their drug at all cost. The people hired by Insys often had no pharmaceutical or medical background at all. These were not people who would even be capable of assessing a patient's need for or ability to handle these dangerous prescriptions. As mentioned, the FDA does allow for a doctor to use an approved medication for an off-label purpose, but it is completely illegal for a pharmaceutical company to promote a drug this way. It is also illegal for interstate commerce, which is what was happening here. This drug was being marketed and sold across all states in the United States. Jurieri kept a log of what succeeded and what failed, not just in general, but to each individual insurer, and provided these to the IRC employees to help them succeed in obtaining prior authorizations. We can see that in this communication here, where she says, I have attached the list of most common insurance payers and the details that coincide with each payer. I've created a tab for each insurance plan at the bottom of the spreadsheet. You will notice that most of the insurance plans indicate that the patient must have cancer, but in actuality, all plans are different. To the best of our abilities, we came up with a somewhat generalized list for you. She prepared cheat sheets for them to have to refer to when speaking to an insurance company. We see here the requirement of a cancer diagnosis, a list of meds, and an answer to the breakthrough cancer pain here. But we'll speak on that in a moment. As you can see her brag that her specialists are very confident, highly skilled, and trained to work on all opt-ins for all diagnoses with all types of insurances plan. Most of the time, this was very successful. Even with all their stealthy ways of getting approval, they were still getting trouble from pharmacies. Pharmacists, like in this letter, were noticing that this prescription had a specific indication and that it was being prescribed beyond that, and often started refusing to fill them, or sending them back and asking for a lower dose. This did not deter Insys. They doubled down in their deception. They asked the cooperating doctors to release patient histories to IRC, where the staff would pore through them looking for any past cancer history. Imagine this. These patients' private, protected health history and information was being given to non-medical staff of a drug company so they could illegally obtain these dangerous drugs. We can also see their strategies here in these bullet points for an upcoming presentation where IRC employees were going to be trained in how to achieve prior authorizations. Notice the first one about always trying for max units. This was one of the biggest problems with this drug. Although dosing had been specifically approved by the FDA, they were starting patients out at a very high dose and titrating them very quickly. You can see bullet point 2 emphasizing the need for a cancer diagnosis. This will come up again later. We already saw on the cheat sheets a list of medicines that supposedly they had tried and failed, and other information. They would then use any cancer history they discovered, no matter how long ago or if the patient was in remission. They would use these as the diagnosis code to obtain the prescription, even if the prescription was being written for a different source of pain. Sometimes there wasn't even any actual cancer history, so they would resort to lying about cancer. In their training material, IRC staff were taught to head off questions by stating, as we see here in the bottom left, that the doctor is aware that this medicine is intended for the management of breakthrough pain in cancer patients. The physician is treating the breakthrough pain for ICD-9 of, and then insert a code. When you see the box next to it, when to use, it can be used before the clinical criteria has been asked as a way of heading off the question, or right after it has been asked. But it can only be used once on a call, presumably to avoid suspicion that might arise from them repeating it too many times. In evidence, there are recorded calls to insurers. We find one instance where IRC employee David Richardson misrepresented that he was an employee of a New Jersey doctor while mispronouncing the doctor's name. He gave the wrong office location, and he used the canned answer above, but when he was directly asked if the patient did in fact suffer from breakthrough cancer pain, he responded, "Yup," which was a lie. IRC employee Gina Flores called another insurer, also misrepresenting herself as an employee of a doctor. She lied about a patient having cancer who had never, in fact, had any form of cancer. Here, we see a pre-authorization form all filled in except for the doctor's signature. It's been marked urgent, and the patient has been given diagnosis code 162.9, which is in fact a type of cancer, and 338.3, breakthrough cancer pain, yet this patient did not have cancer. Here we see where the doctor signed it and faxed it back, even though he knew his patient did not and had never had cancer. These are only a few examples of a behavior that happened constantly. Another tactic they would use is to supply patients with what they called super vouchers, which would be given to them for free medicine while waiting for the authorization to go through. These drugs have a strong addiction rate. Getting them hooked on this drug was a cruel but useful ploy to keep them wanting their meds. It also served to build a history of Subsys use for patients, which would make authorizations easier later. On April 19, 2013, Juriari stated during a conference presentation that IRC needs to know if a patient had cancer in 1992 or if they have cancer, even if that's not what the doctor is treating them for, because the cancer diagnosis is almost an assurance of approval. She also stressed the importance of patient fact sheets to be collected from the doctors because, quote, that's how they find a history of cancer a lot of the time. It's notable that a history of cancer doesn't mean current cancer diagnosis, but it could be manipulated to help them get their precious prior authorization. Imagine, again, thinking that your doctor is passing your private health information along to an unscrupulous department of an unscrupulous pharmaceutical company to get drugs that you should not even be being prescribed. It's unbelievable. More unbelievable is in a lot of these cases, they began this prior authorization without the patient even agreeing to taking the medication. Sometimes it would just show up in the mail. In addition to all of these manipulations, IRC provided a medical necessity letter to be used to appeal any refusals that contained a new claim of difficulty to swallow, which we'll see more of in just a minute. This was used to appeal denials, as you can see in the first paragraph. This letter of appeal is in response to the denial dated, and then they fill in the blank for patient, fill in the blank. Here's the new bit. Has difficulty swallowing and digesting oral medication, and is in almost constant severe pain, with the significantly limited quality of life, unable to sit, stand, walk, or reach, which includes participating in family life and riding in automobiles. In an effort to control his pain and improve his quality of life, they have been prescribed the following medications. Then they were supposed to fill in the highest dose available of a drug, saying that that tends to abate the pain fairly well. However, severe breakthrough pain continues to be a problem with the frequency that is debilitating to this unfortunate patient. Then they would make a claim that a specific drug name, now remember there was a cheat sheet to provide them with the drugs that would be appropriate to use on these forms, and then say, but that medication was denied coverage. Injectable pain relievers are not an option. They really would lay it on thick to make it seem that Subsys was the only possible solution to this patient's extreme excruciating pain. Sort of a last resort idea. So this new claim of dysphagia or difficulty swallowing, it helped because most pain prescriptions are in pill form. So if you can't swallow a pill, how very helpful that they could spray this under their tongue. According to the FBI agent affidavit, IRC employees said that Juriari told them to put dysphagia on every single authorization. She admitted that they didn't have it, but she said that's what we have to do to get it approved. Lastly, Juriari told IRC employees to tell insurers that a slew of other meds had been tried but had failed. And we kind of touched on that in the last bit. But here is the list they were provided of preferred drugs to tell insurers which drugs had been tried and failed, even though this was not true. So because of these actions by the IRC, in July 2013, in a presentation from the board of directors, they indicated that IRC's prior authorizations worked over 75% of the time. By November, just 4 months later, it was 100%, up from 30 to 33% the previous year. As mentioned, some pharmacies became suspicious and would return prescriptions either refused or asking for a lower dosage. So yet another evil plan was hatched. Insys switched to a mail-order pharmacy, Linden Care, who happily took on the task of mailing prescriptions, leading to addiction and death for so many patients. They have also been named in multiple lawsuits together with Insys. So this covers point 1 about the IRC. The other 2 points about misleading information and sham speaking events will be covered later in this series. This episode, episode 1, was about Insys itself, Subsys, and the IRC. Episode 2 will be about the sales force. Episode 3, the prescribing doctors. Episode 4, some of the victims. Episode 5, the trials. Thanks so much for your patience, as each one of these episodes requires a great deal of research. Hope to see you again soon. Until then, this is Cassidy O'Connell saying stay well and stay tuned.